So I'm a neuroradiologist. I design imaging protocols. I tell the machine how to take the picture a certain way. I don't actually take the pictures. Your interaction is mostly with our techs, either CT techs or MRI techs. But what I do is, after the pictures are taken, I interpret them, and I make diagnoses from those images. From my interpretation, I have to put out a report, and the report goes to you, but it also goes to the referring physicians, the neuro-oncologists, the neurosurgeons. And then we gather all these reports, we gather multiple scans, and we have a brain tumor team. We call it a tumor board. It's a board of people that gather together to talk about patients like yourselves. And we consult with each other. Neurosurgeons ask me questions. Does it look better or worse? And then together we come up with a follow-up plan. Imaging modalities, what types of scans are there? Well, first is the computed tomography, all right, or the CAT scan, which came about really around the 1970s, developed into the 1980s. And then we came up with MRI. And we'll talk a little bit about how an MRI is done, but it stands for magnetic resonance imaging. We'll also cover some advanced techniques of MRI. Over the past 2 decades, we've really developed some really special techniques. After that, we'll talk a little bit about PET scans, or positron emission tomography. What I do is, in terms of diagnosis, I take different appearances, because different tumors can have different appearances, and I try to give my best guess as to what kind of tumor this is. And then my best guess will then lead the neurosurgeon to having a certain type of approach, for example. Just recently there was a patient that came in with a mass in the fourth ventricle. Now it makes a big difference as to whether this is an infectious mass or whether this is a neoplastic or a tumor type of a mass. And so I gave my best guess that this may have been a parasite because the patient was, had recently come from another country. So those are the kinds of things that I do, and we kind of guide the clinicians as to which direction to head in terms of treatment and also management. We also, after surgery and for post-operative assessment, we have to make decisions on whether the entire tumor was removed or was there a little bit left. Is there something that is then amenable to radiation therapy? And also follow-up is important, and I'll be talking about that in my talk. And specifically with tumor monitoring, we have many challenges, and I'm sure some of you have experienced some of those challenges, trying to figure out if a tumor has really come back or is it not.